Hello and thank you for joining us, whether you're watching on television or online. I'm Anthony Robart. We, of course, are waiting for the latest update from Prime Minister Justin Trudeau. Now, he is expected to walk out of Rideau Cottage in about 15 minutes, a little less than that, where he continues to self-isolate. Now, some good news when it comes to the Trudeau household. We learned over the weekend that Sophie Gregoire Trudeau has recovered from COVID-19 and has been given a clean bill of health from doctors. She actually sent out a message online expressing her gratitude and her expression of support to all Canadians. Now, while we wait to hear from the PM, let's bring you up to speed on some developing news. The number of COVID-19 cases continue to rise at a rapid pace. Look at these numbers. There are now more than 735,000 confirmed cases worldwide. There have been nearly 35,000 deaths, and obviously a grim number. The United States, meanwhile, has become the global epicenter of the pandemic, with the most cases of any country in the world. 140,000 cases, nearly 60,000 of them in New York alone. Let's look here at home. In Canada, more than 6,200 people have tested positive. So here is where the Canadian the numbers stand today. Quebec has the most confirmed cases, with more than 2,840 to be exact. In Ontario, more than 1,700 confirmed cases. In total in Canada, 63 people have died. Now, those numbers, of course, will change. We expect more testing and the results to come in, and obviously a very fluid situation. Now, looking at the number of deaths, that number sadly is expected to rise because one nursing home northeast of Toronto has been hit especially hard in recent days. Global News has confirmed that 9 residents have died. More than 30 staff members have developed symptoms here. This is at Pinecrest Nursing Home. This is in Bobcaygeon. This is believed to be the worst outbreak in Ontario, in fact. The facility's medical director describing the home as a, quote, war zone, saying more deaths are inevitable. Let's look out west. In British Columbia, there are at least 12 long-term care homes where residents or staff have tested positive for COVID-19 and several deaths reported. And in Quebec, public health authorities have placed an Orthodox community of around 4,000 people under quarantine. This 14-day containment order for the community was issued on Sunday. Around 100 tests have been conducted among community members. Officials say more than 40% of the tests with results have come back positive. And some developments when it comes to the Olympics. The organizers of the Tokyo Games have confirmed new dates after the original games were postponed because of the coronavirus pandemic. Opening ceremony will now take place on July 23rd, 2021. Almost 1 year exactly after the games were due to start. The closing ceremony is slated for August 8th. Olympic organizers promising to provide a, quote, light at the end of a dark tunnel for humanity. Now, certainly, it has been a dark tunnel for a lot of people, and Canada's top health official says what happens this week is crucial in the fight against COVID-19. Let's go to Ottawa now, where our Global's Abigail Beeman is standing by. Good morning or good afternoon, and depending if you're watching in Atlanta, Canada. Abigail, thank you so much for joining us. Let's begin on the news today. Last week, we heard the wage subsidy response from the government. What do we expect to hear today?
Well, good morning or good afternoon, Anthony. We are expecting to hear more details on the huge announcement that came from the Prime Minister on Friday. So initially, the government was offering a 10% wage subsidy. This is in an effort to keep people on the payroll so that employers don't have to lay people off, which would also help with a smooth transition back to work later when this is all over. Then on Friday, the Prime Minister announced that wage subsidy no longer 10%, but a huge increase to 75%, which will, of course, make a lot of difference for many small and medium-sized businesses. But some huge questions were left unanswered, and that's what we are waiting to hear from today. So what is a small or medium-sized business? What size of business do you have to be to qualify for that 75% wage subsidy? And also, is there a cap on amounts? How much money are businesses eligible? Many businesses are really desperately waiting for this this information. Nobody could provide it on Friday. So we're hoping, because the government said that it would be available by Monday. So looking for some answers there. In addition to the wage subsidy, also on Friday, the government announced a number of other measures to help businesses, government-backed loans, defer or delays on tax deadlines. The finance minister later said on Friday that would total close to $100 billion, or the equivalent of, with all of these measures. Still waiting on details there. So a lot hanging on how much information the government provides today in terms of the much-needed support to businesses.
Yeah, obviously clarity is in a short supply right now, because a lot of people are just, with the bills piling up, and a lot of people are waiting as they are confused in exactly not just the process, but how long it's going to take. Let's also talk about the country's Chief Medical Officer of Health keeping a very close eye on the hotspots in this country. Quebec leading the nation, Ontario and Alberta. Why is this week so important in this battle?
Well, there are a few reasons, Anthony. First of all, there are a huge number of returning snowbirds, perhaps spring breakers as well, that will be coming back into Canada. And of course, as you know, the government has now implemented the Quarantine Act, meaning anybody returning from anywhere needs to self-isolate for 14 days. Yesterday, we heard some further clarification from the Prime Minister on a question of, am I allowed to go outside for a walk if I don't have any symptoms and I've returned from somewhere else to Canada? And the Prime Minister very clearly said, no walks are allowed if you're in that situation. So a lot of people returning, in the case, as I mentioned, from the United States with the snowbirds. There's a concern there as to whether that will add increased pressure on the healthcare system, whether people will actually follow the rules in terms of the now legally enforceable quarantine that's upon them. But of course, the other part of the picture in terms of why this week is important is that it takes up to 14 days, is generally accepted, for symptoms to appear in terms of coronavirus. That's why you see this 14-day quarantine enforced. So before these stricter measures were taken, there were so much more exposure before we had such tighter social distancing, physical distancing rules. So this week will be really important to see how the number of cases play out throughout the week. Given that 14-day time frame, we may know a little more by the end of the week, but we still could be a couple of weeks away from a potentially larger surge.
Now, looking at some of the numbers, there's some confusion over the weekend when it came to the number of cases for those under the age of 40. That was clarified by Dr. Theresa Tam to 12%. These are 12% of hospitalized cases we have to keep in mind. Can you elaborate on that and really what the message is for all of Canadians, especially those under the age of 40?
Yeah, it's something important to speak about. So as you say, of the cases in Canada, we're speaking Canadian cases, of those people who need to go to the hospital, 12% of those hospitalized are under the age of 40. The message that Theresa Tam is trying to get out here is that the virus does affect younger people. It's not just the elderly who are at risk of this virus. There are people under 40 ending up on ventilators, in the ICU, ending up in hospital as well. She wanted to stress that message. But I think also worth pointing out in terms of this onslaught of information, some of it confusing, some of it incorrect. On Saturday, Dr. Theresa Tam came out and said that number was not 12%, but 30%, that 30% of people under 40 required hospitalization. That set off a lot of questions and talk about that. She then had to come out and clarify. The clarification came in some places in the evening and then the next day she tweeted it. It was an example to me of some of the issues in communications here when we are dealing with very important information. But bottom line, according to Dr. Tam, is that it's important to know that young people are affected. And again, that correct number is 12% of the Canadian cases of people hospitalized are under the age of 40.
All right, still 12% is a concerning number, no question about that. Let's talk about the repatriation efforts right now. The cruise ship that is stuck off the coast of Panama, there have been some developments when it comes to that. First of all, getting the ship to North America, to Florida, and then what's the latest on the effort to get the Canadians home and what will happen?
That's right. So in terms of the Zandan, the latest information that we have from Global Affairs Canada is essentially that they're still working on it, that they are, very aware of what's going on, and they're working to bring those people home. We do also know that there was a sister ship that was brought in to transport some of those passengers off the ship, and we are told that all of the healthy passengers have been moved to that sister ship, but there are still a lot of questions about the when and the how, and in terms of getting those Canadians on board. 247 Canadian passengers, as well as a Canadian crew member on that ship. So still waiting for some more information. But we can also talk about how there are still approximately 400,000 Canadians around the world who are still not home. And we've seen day by day that number shrink. It's now the number provided by Global Affairs, I believe, is 398,000 Canadians. It has been steadily shrinking as thousands and thousands of Canadians make their way home in very challenging situations. Again, I should point out that number is from people who have voluntarily registered. It could be much higher from people who are choosing not to register with Global Affairs. But the bottom line from Global Affairs is they say that they are working very hard to get Canadians who want to come home. There are a number of flights planned from countries in Africa as well as South America. There are a number of places, but also want to point out that the messaging from Global Affairs had a very stark shift in the past couple of days. At first, the messaging came out was, we've got this, we're going to get you home. In the last couple of days, that messaging has changed too. There may be a lot of Canadians who are stuck in locations for an indeterminate amount of time. They're working to help through the consular assistance available, but the messaging has changed to, if you are in one of these places, if you can't get home immediately, you need to obey the local procedures and laws in terms of lockdown and quarantine. Everywhere, of course, has different rules. We're hearing especially a lot of Canadians in India having trouble returning home and getting out, and we have not heard any specifics on a plan there.
Well, certainly a long and difficult journey, and we'll be following very closely. Abigail, we will touch base later on. Thank you so much. Let's stay in Ottawa for our Ottawa Bureau Chief, Mercedes Stevenson, who joins us now. Mercedes, thank you so much for joining us. Obviously, a lot going on. Let's get to the question. Travel restrictions. They were announced over the weekend, going into effect in less than an hour right now. What can you tell us about that? Exactly what does that mean? And effectively what it doesn't mean, because there are a number of sort of modes of transportation, buses, for example, where this doesn't exactly apply. Elaborate on that.
Yeah, so there's a few things to think about here. First of all, they're asking everybody, no matter where you are, not to travel right now unless you absolutely have to. And by have to, they don't mean really want to see somebody, already had plans. They're talking about travel that would be medically necessary or trips to the grocery store. You're not supposed to be traveling at all. You're supposed to be staying at home. In terms of what the government will start enforcing, well, that has to do with travel within the country for people who are exhibiting symptoms of COVID-19 in particular. So if somebody comes in off of one of these international flights repatriating to Canada and they have any kind of symptoms, they will not be able to board a connecting flight, train, anything. They will be kept near the airport in quarantine for 14 days, because the concern was that you had a lot of people coming home who were symptomatic, and they might not be detected on the way in. Perhaps they don't have any symptoms. Perhaps some concealed those symptoms. They get back into Canada because they're being called home by the government, but then they get on another plane. And now you're talking about exposing a whole bunch of people on that plane. So it takes care of the symptomatic part that will now kick in, but there's a whole bunch of questions here. People who are carrying it who may have very mild symptoms and haven't noticed. Some people almost have no symptoms at all, and it's very difficult to detect. Still looking at being able to make those flights. There's still some confusion about how to enforce that. Transportation workers who are frontline, i.e. those who are, for example, flight attendants, those who are working on the trains, are the ones who are being asked to look for passengers who might be symptomatic and to stop them from boarding. And some of what I've been hearing from people who work in that industry is that they're worried they don't feel they're qualified to be able to do that. They want training, they want personal protective equipment. If they're the ones who have to enforce that, they want to know this. Once you get home, you will be monitored to make sure that you are staying home. There's still questions about how effectively the government is going to be able to do that, how exactly exactly they're going to be tracking people, ensuring they're not out. But we've heard of cases now where the police have gotten involved, where people are not respecting that quarantine. I'm at home right now, Anthony, because I was in the United States. That means 2 weeks at home. That doesn't mean that I can go out for walks. I can go on to my little balcony that's behind me here. That's it. I cannot go and visit people. People cannot come and see me. All of those things. So they're really trying to emphasize those restrictions, but there's still a lot of questions for people, particularly who are working in the industry, around how they're supposed to know to enforce this. And what about the people who are coming back who are asymptomatic, still boarding planes, but potentially could be carrying COVID-19. So I expect that we're going to hear more questions about that at the Prime Minister's press conference today.
So if you are just joining us right now, we're awaiting the Prime Minister's address from Rideau Cottage. That is expected really any moment now, as he has been given the daily. There you see a live shot of his home where he continues to be in self-isolation. This is what, if I'm not mistaken, about 18 days since he found out that Sophie Gregoire Trudeau, his wife, was diagnosed. Certainly more than the 14 days required, but he continues to work from home. And Mercedes, I want to ask you about the personal protective equipment. This came out over the weekend, a donation from China. This follows, of course, Canada's donation, while that country was in the onset of this epidemic. Talk about what that really means in terms of numbers, and also the question of the quality, because this is also following a report that the Netherlands sent back 600,000 personal equipment to China. What do we know about that?
Yeah, great question, Anthony. So basically, there's been a lot of concern from frontline first responders and medical teams about having, enough of that personal protective equipment. And that would be things like masks, gloves, and face shields so that they don't contract COVID-19 while they are working very closely on patients who have it and have symptoms like they're coughing. So you're talking about it aerosolizing all around them and potentially being in their faces. So they want to have that, and they're saying that in some places they're already being told to prepare to ration for it. The federal government keeps saying that we have enough and that we will have enough once the supply arrives from China. They haven't revealed exact numbers, and we're still trying to figure out why we're hearing different concerns from frontline medical staff than the information that the government is giving in terms of saying that there is enough in the strategic supply for now. They also say the provinces are not flagging to them that there's a problem with this. It is in many ways primarily provincial because healthcare systems are, but anything that has to do with strategic federal reserve, stuff like a pandemic, that starts to involve the federal government as well. So China has said that they are shipping PPE to Canada to help supplement that. But in other countries like the Netherlands and the UK, they found that in some cases, thousands of those pieces of equipment were defective, didn't work properly, were missing parts, and sent it back. They're sending a huge amount. So how much of that will be functional, we don't know. But that's been one of the questions put to the government. If we're relying on this shipment from China, and they haven't suggested that we're relying on that alone, but if we're partially relying on that and part of it may not in fact be reliable or usable, how do you get around that? And one of the things that the government has done is asking for industry to kick in. So even people who have 3D printers, they're asking them to print off plastic face shields for those who are working on the front lines. But there's a lot of concern from police officers, paramedics, firefighters, nurses, doctors. I'm hearing from all of them who are saying they're worried that masks are going to be rationed, that they will have to wear masks for longer than they're useful or to reuse them, which could potentially be dangerous because they're picking up something that could have COVID-19 virus on it. So there's still, I think, a lot of questions to be answered about PPE and whether we have enough of it. No one's running out at this point, but there's serious concern that that could happen, and trying to get ahead of that curve so that those who are doing their jobs have the ability to do so safely.
Yeah, and a lot of medical professionals looking south of the border to that situation, especially in New York, where they are not just rationing, but a lot of questions surrounding that, and following the grim prediction from the head of infectious disease there, Dr. Anthony Fauci, saying that there could be between 100 and 200,000 deaths. So obviously, a prediction he hopes does not come true. Nonetheless, people emergency response at heightened alert. Talk about here at home when it comes to the response from the military, because we heard, what is the latest on that? Because the Quebec's premier was asked about this, whether this is even an option. He says this is not a consideration yet. What is the military? What's the response from them? Are they on standby? How would we characterize it?
Yeah, so the military has been preparing for this for several weeks. They are ready to go if they are called into action. Part of what they do is always plan for the worst case scenario, and they have the worst case and the best case, and they have a whole range of plans. Everything from helping with logistics of people going into hospitals and large crowds to what happens if they need to provide medical support to the Canadian medical system. That already happened with the Canadians who were coming back, by the way, from China. It was military medical staff who were on those first flights. They're also looking at things like helping with logistics, transport. You could have a situation where the government wants people locked down and asks the military to enforce that by having things like road checks where people would have to drive through or explain where they're going, why they're out. There's a whole range of options. The military has been preparing for. General John Vance, who's the chief of the defense staff, put out a note on Friday, unprecedented 5-page letter to the troops, saying that essentially they are on a war footing and they have to be ready to go at any moment, and they will need the help of reserves and Canadian Rangers to be able to do this across the country. But if they are called into action, it will also stretch them very thin. They have stopped recruiting, and they're asking those who are planning to discharge to reconsider their plans to do so and potentially stay in until this is over, especially because the military could be called in to simultaneously fight fires or deal with floods and COVID-19 at the same time.
What do we know about the development or the building of makeshift hospitals? We saw in the UK, in London, for example, they procured a shopping center to be used eventually for hospitals if necessary. In New York, convention centers. What steps are there in this country to address that?
There are plans looking at what buildings are available and what could be done. Public health does have the authority to seize things like hotels. There could be something like a convention center being used. I have talked to people who have seen plans for major cities in Canada as well as the federal plans who say that's absolutely part of what they're looking at. At this point, they haven't actually started to build any of that because our hospitals have not yet been overwhelmed. But that's part of why this week and next week are so critical as they see sort of the infection rates starting to climb and the number of people who may need hospitalization. And that's where we're going to get a sense of how serious is this situation. And in some cases, it's shortages of things. I was hearing from one person here who works in a hospital, things like IV pools. Seems very basic, but we're very used to having enough IV pools for everybody to have that IV, and it has a pump that determines how fast you get your medication. It used to be you had to do that by hand. They're preparing to go back to having to do that by hand again. And that would require literally a lot of extra hands and potentially something like the military to come in and help to make sure patients are getting those IVs. At this point, no one federally or provincially thinks that they need the military, but they're certainly having that as an option there. It's a safety if things become overwhelming that they can then, in fact, call that in for support.
And the Prime Minister over the weekend talking about more help for the vulnerable, children, a donation or money for the Kids Help Fund, for example, but also seniors. If you can elaborate on seniors and where that money exactly would go. Obviously, there is a long list of people in need, seniors among them. Talk about that for a moment.
Sure. So this is a big concern for seniors. Number one, many of them are isolated. Their family can't go and visit them right now, and that's a very difficult situation. They're worried about their finances. They're worried
Mercedes,
about
I am going to have to interrupt. Prime Minister Justin Trudeau just walking to the podium right now. Let's listen.
Apologies. Hello, everyone. Bonjour tout le monde. Merci d'être des nôtres. Pour lutter contre la COVID-19, nous demandons à tout le monde de rester.
To fight COVID-19, we ask everyone to stay home to all the extent possible. And our directives and recommendations have slowed down the activity of companies. Some had to close down, and which is a source of worry, not only for employers, but also for employees who need their paycheck to cover their needs. This is why we set up a three-pronged plan in order to protect jobs, people who've been laid off, and support companies which have cash difficulties. And we know that most people want to be able to continue some salary. And this is why we have announced a support for wages in order to a wage subsidy.
Subsidize up to 75% of wages for qualifying businesses. We know what businesses are going through. Over the past weeks, you've had to get creative to keep money coming in. And in some cases, you've had to make the difficult decision of letting your employees go. For people to get through this tough time and for the economy to rebound, People have to keep their jobs. So we announced the Canada Emergency Wage Subsidy. I said last week that we'd have more details to share, and that's the first thing I want to talk with you about today. If your business's revenues have decreased by at least 30% because of COVID-19, you will be eligible for this subsidy. The number of employees you have will not determine whether or not you get this support. It will apply to nonprofit organizations and charities, as well as companies both big and small. This is about making sure that people are still getting paid, whether they work for a business that employs 10 people or 1,000 people. So here's what this means for workers. If you work for a company that has been impacted by COVID-19, the government will cover up to 75% of your salary on the first $58,700 that you earn. That means up to $847 a week. As I mentioned on Friday, this will be backdated to March 15th. This subsidy will make a real difference in your lives and help everyone affected bridge to better times. In Quebec, it's going to help trucking and logistics company Energy Transportation Group to stay in business so they can keep moving essential goods like food and toilet paper. In Calgary, it'll give a little breathing room to the Benge Hair Salon, which had to close shop to protect the health and safety of their clients. Minister Morneau and Minister Ng are working hard to give companies the background documents explaining the technical details of this measure. And on that note, I want to thank the public service who's working around the clock to get this done.
Companies able to show that they have had a loss of more than 30% in their income will be eligible for the wage subsidy announced last year. The number of employees will not be a criterion in order to determine eligibility. It will apply to NGOs and charities and also companies, whatever their size. We want people to be able to receive a salary, whether or not they work for a company which employs 10 or 1,000 people. So if that company that you work for is affected by COVID-19, the government will be covering up to 75% of your salary for the first tranche of $58,700, which means $847 a week, up to $847 a week. As I said last week, this subsidy will be retroactive to March 15. And Ministers Morneau and Ng are working very hard for the purpose of providing more details to enterprises and companies as quickly as possible. And I want to thank the whole of our civil service, which is working 24/7 for the purpose of providing information updates.
About you, about hard-working employees across the country. It's about making sure you have money to buy groceries right now and a job to come back to later, once we're through this. Every business of every size is having to make some difficult decisions because of COVID-19, and that's why the number of employees is not the eligibility criteria we've chosen. This is in line with best practices we've observed in other countries. That said, I want to offer a word of caution to businesses. We are trusting you to do the right thing. If you have the means to pay the remaining 25% that's not covered by the subsidy, please do so. And if you think this is a system you can take advantage of or game, don't. There will be serious consequences for those who do. This unprecedented situation calls for unprecedented action, and it calls for good faith and trust between everyone involved. We are in this together, and that's why our government is stepping up to help all employers keep their employees. But for this to work, everyone has to do their part. Every dollar of this should go to workers. You should make every effort to top up their wages and every effort to hire back those workers who've been laid off in the past 2 weeks because of COVID-19. That's why we set up a comprehensive three-point plan to support everyone across the economy, weather the storm, and come roaring back. With the Canada Emergency Wage Subsidy, we're protecting jobs. With the Canada Emergency Response Benefit, we're helping those who lose their job. And with easy, guaranteed loans for businesses of all sizes, we're helping people who need it access credit.
Let me now speak to corporations for a minute.
We trust you to make the right decisions. If you have the means to do so, pay the 25% that isn't covered by the wage subsidy. If you can, do. If you think you can game the system or take advantage of it somehow, don't. There will be serious consequences for those who try to benefit from it. This is an unprecedented situation, and that means we need to take unprecedented measures. However, the crisis calls on us to have confidence and act in good faith. We are all in the same boat, and that is why the government wants to help all employers to keep their employees. But if the strategy is to work, everyone has to do their part. Every dollar needs to go to your employees, and you have to do everything you can to top up their salaries and rehire employees who've been laid off over the past 2 weeks. We have a three-point plan to help the economy rebound for employers and employees. We have the emergency wage subsidy. If you lose your job or if you are self-employed, there is a new emergency benefit, the Canada Emergency Benefit. And if you have liquidity problems, we have announced a range of measures to help you with that. Moreover, to leave you more time to make payments and so you can have more money for your everyday expenses, we have postponed GST and sales tax payments as well as import taxes until June.
Our top priority is to get you the help you need. To do that, our government must be ready for every scenario. Over the past few weeks, the Canadian Armed Forces have been gearing up to support our efforts and our communities as we fight COVID-19. Our women and men in uniform have always been there for Canadians in their time of need, and this pandemic is no exception. Pour l'instant, le gouvernement fédéral n'a reçu aucune demande d'intervention de la part des provinces.
So far, the provinces have not asked for the military to intervene, but if that were to change, the armed forces are ready to answer the call as they have throughout our history, be it to provide medical equipment, be it to protect your homes during flooding or during forest fires. Those who wear the uniform will be there for you. They have a plan to support our communities during this difficult period. At noon, ministers and the Chief of Staff will hold a press conference to provide more details. We are also talking about emergency preparedness with premiers. That will be done further during our next virtual meeting. I'd like to take the opportunity to thank every member of the Armed Forces for their service and for their work. You are always ready to help, and we appreciate what you do for us.
I know we're all looking forward to the day when things are back to normal, but for that to happen, we all need to keep taking the right steps today. It means following public health recommendations. You know the drill. Stay home as much as possible. Wash your hands often and keep at least 2 meters from each other. And our government will keep doing everything we can to make sure workers are getting paid and companies are supported. The measures we've announced will help do just that and ensure that our economy is well positioned to recover from this. We're going through a tough time right now, all together, but you know, your government has your back. And as always, if we need to do more, we will do more. I want to close this morning by thanking all first responders across the country who are doing an incredible job for all Canadians. medical professionals, first responders, custodial staff, farmers, people who work along the supply chain. Thank you. Going to work right now is stressful, and I know you're worried. But we are doing everything we can to keep you safe. You are doing essential work, and we cannot thank you enough. As always, Canada and Canadians will get through this by leaning on each other and everyone doing their part. Merci beaucoup, mes amis.
Merci beaucoup, Monsieur le Premier Ministre.
Thank you, friends. Thank you, Prime Minister. We'll go to questions. Questions on the line. Moderator, the floor is yours. Thank you.
The first question is from Ryan Tillety, National Post. Your line is open.
Yeah, good morning, Prime Minister. I'm wondering with the wage subsidy, do you have an estimate right now as to what that'll cost the Treasury, what the overall cost of that will be?
We have been making changes to what we've been doing over the past days and weeks. These costs keep climbing, but I can assure people that our focus right now is on making sure that Canadians keep their jobs, even if they're not working at them right now, and keep their paychecks rolling in. That people who lose their jobs get the Canada Emergency Response Benefit to help them get through this difficult time, and that there is credit to access for companies and businesses who need to bridge through in the coming weeks. Our focus is on making sure that Canadians are safe now and that our economy can bounce back strongly after this time of slowdown, of stoppage, is done. Fortunately, Canada has taken responsible decisions over past many years to have one of the best balance sheets in the G7. We have been making sure that we have money aside for a rainy day. Well, it's raining. And we are now able to invest in Canadians, to support Canadians as we make the difficult decisions needed to get through this and come back stronger than ever before.
But do you even have sort of a ballpark estimate? Is this going to be in the tens of billions, the hundreds of billions?
The Finance Minister will be addressing Canadians alongside the Minister of Small Businesses and others tomorrow with many more details, including detailed costings and expectations. Right now, our focus is on creating a program that is going to help Canadians keep their jobs, stay in their jobs, even if they're staying at home, so we can all do the things we need to do to keep ourselves safe, to keep our families safe, to keep our health workers safe, and to keep all Canadians safe. We will get through this. That's what this is about. Okay.
Right now, our focus is to get through this crisis, and to do that, we need Canadians to be able to stay at home, to be able to do what they need to keep themselves and others safe. We understand how difficult it is for companies, for businesses, and that is why we are giving them a wage subsidy so that they can keep their workers on until we come out on the other side, so that after the crisis in the coming weeks and months, after this is done, they can come back strongly. That's the priority. Tomorrow, the Minister of Finance and the Minister of Small Business will have a press conference to answer questions and provide more details. But right now, we want to reassure workers across Canada that we will be there for them. Next question.
Prochaine question, Raymond Filion, TVA.
Raymond Filion, TVA. Prime Minister, good morning. We understand that there will be more details. When might these subsidies, wage subsidies, be paid to businesses? We're working to roll this out as quickly as possible. At present, the priority for Revenue Canada is to make sure that the Canadian Emergency Benefit reaches people who need it as quickly as possible. But I can tell businesses and business owners right now that this help is coming. So please rehire employees you've had to lay off. Please rest assured that you will be able to pay them. the government will be there for you and will subsidize 75% of your payroll if you've been hit by COVID-19. We are trying to make that money flow within very few weeks, but until then, you will have access to credit that will bridge the gap. Rest assured, we will help. On another subject, Prime Minister, yesterday, the U.S. revealed some staggering numbers about the number of deaths they expect. Is Canada following the U.S. trajectory? Proportionately, of course. Proportionately, no, we are not on the same trajectory. We were faster with testing, and we were more successful at imposing isolation measures. But it's really in the coming week or two that we'll see whether the measures Canadians started taking 2 weeks ago are working and how well they're working. Everything will depend on the choices people make. So far, I've been tremendously proud of the way Canadians have rallied together and are working together to make sure that they follow directives, because that is what will dictate how well Canada comes out of this. I'm very proud to be a Canadian today. Next question. Hélène Buzetti, Le Devoir. Good morning, Mr. Trudeau. The construction work on Trans Mountain is continuing. It belongs to the federal government and their Indigenous workers who are afraid of having people outside the community working on this because they fear for their health. Why has the work not stopped? That's a very good question. A number of decisions are being made across Canada about who is an essential worker and who isn't, what work can continue and what work shouldn't. I will follow up and give you a more detailed answer tomorrow. Now, about today's announcement, you said there will be serious consequences for business owners who are trying to game the new wage subsidy. Why do you feel that warning is necessary? Do you feel that there is a risk for the program to become an open door that's easy to exploit? No, it won't be easy to exploit. We have established very clear parameters and criteria that businesses need to follow to help them keep their employees, to bring them back if they've been laid off. But we do understand that when the priority is to provide assistance to the largest number of people as quickly as possible, things are done quickly and some confidence is required. We need to count on the fact that people will behave as they should and not take advantage of the system. But I do want to assure everyone that in the coming weeks we will have ways to monitor the program for any abuse, and if any is detected, there will be serious consequences for anyone trying to take advantage of the system and to take advantage of Canadians in these difficult times. Thank you. Next question.
Next question, Brian Lilly, Toronto Sun. Your line is open.
Prime Minister, I'm wondering, with the economic hardship that so many Canadians are facing, even once this wage subsidy does kick in, have you or other MPs thought of foregoing your raise that kicks in on April 1st, or pausing the carbon tax that is set to go up by 50% on April 1st?
The price on pollution has been designed as to put more money in households' pockets, more money in the pockets of the middle class, while we do the things that are necessary to fight pollution and protect our planet. That is something we are going to continue to do, because we know that we need to do things to make sure that we're both supporting families through ordinary times and through difficult times, and moving forward on continuing the fight against climate change, which remains, even at a time of immediate immediate crisis and pandemic. In regards to salaries, I haven't heard the Parliament of Canada having those discussions, but I'm sure they will reflect on it now that you've asked the question. Okay. Par rapport au prix sur la pollution, nous l'avons mis en place de façon.
Regarding the price on pollution, we have set it up so that it provides more disposable income for the middle class, for Canadian families. It is important that we support families while we fight climate change, and we will continue our fight against climate change.
You talked about on Saturday. You had previously dismissed those for international flights. You had dismissed calls for banning travel earlier on, even just less than 2 weeks before you eventually did. At that point, most of the cases of COVID-19 were travelers coming into Canada. Now it's 63% community spread. Do you regret not acting sooner on travel restrictions at airports for international flights from hotspots?
I think there are going to be lots of analyses after the fact around what happened when, what could have happened a few days earlier, what only needed to happen a few days later. Our focus every step of the way is doing what was necessary at every moment based on the recommendations of experts, based on science, and doing what we can to keep Canadians safe. We're obviously not in an unprecedented situation, always going to get things perfectly right, but we are going to continue to be committed to doing the right things as best we can and figuring out what works, what doesn't work, and moving forward in a way that is both nimble and focused on helping Canadians in so much as a government can be nimble and agile. I think we've demonstrated that we're going to stay focused on Canadians and doing the right things, and that's what we'll do.
Prime Minister Julie Van Dusen, CBC. Hi. How can you get an accurate picture of the extent of COVID in this country without more testing, a lot more testing, especially of those who work in essential services who may be out there without symptoms and spreading the virus and not even know it?
Over the past few weeks, we've been ramping up massively our testing capacities, and that continues, both with more tests, with better tests, with different kinds of tests, with tests that return results more quickly. These are the kinds of things we know are an essential part of managing the spread of the disease and, indeed, reducing the spread of this disease. We will continue to ramp up our testing efforts, but at the same time, the measures around self-isolation that have been put into place are also going to be extremely effective for keeping people at home. If you think you have symptoms of COVID-19, self-isolate. Take measures to not spread. And whether or not you get a test back immediately or tested right away, you can take measures through self-isolating yourself that will prevent the spread. As we move forward, we will get more and more measures to test more accurately, test more rapidly, get those results back, and keep Canadians safe. But right now, these self-isolation measures are an extremely important thing while we ramp up our testing capacities. Okay. Nous comprenons à quel point le dépistage massif.
We understand how important widespread testing is in getting an overall picture, and that is why every week we have substantially increased our testing capacity. We are continuing to ramp up testing because we will need to manage the crisis for the coming weeks and months. We will need much more testing, but for now, isolation measures are crucial. This is why they're crucial. If you feel you have any symptoms or might have any symptoms, it is crucial that you don't wait for positive test results before taking action immediately. Isolate yourself immediately so that you can protect your family, your community, and not spread the disease.
And if there will be help for the energy sector, and with Canadian oil opening up at less than $5 a barrel today, Is there going to be any specific help for the energy sector, and if so, when?
First of all, the emergency wage subsidy that we've announced will help companies large and small across all sectors of the economy, and that will go a long way towards reassuring Canadians and workers that they're going to be able to get through the coming weeks. At the same time, we recognize there are certain industries that have been extremely hard hit by both the drop in oil prices and the COVID-19 challenge, whether it's airlines or oil and gas or tourism. There are significant areas where we're going to have to do more. And as I've said from the very beginning, we will be doing more. Okay. Nous reconnaissons que
we recognize that people are having tremendous problems, and the emergency wage subsidy is going to help workers across Canada who've been affected by COVID-19. But there are specific industries that will be hit harder than others. For example, the airline industry, the oil and gas industry, tourism. And they will need more help. We are trying to see how we can do more for them.
Why isn't the federal government releasing their modeling numbers? In addition, what about predictions there could be a second and third wave? And if you could answer in French, please. Thank you.
We will continue to release the information we have in as accurate a way as possible for Canadians to see how we're doing and where we're going. At the same time, we recognize that what's going to happen a week from now, 2 weeks from now, a month from now is extremely dependent on how people are behaving today. And with the built-in lag in COVID-19 around 2 weeks, with the delays in getting test results and in getting results from provinces, we know that there's not always an accurate picture today of what's happening today. That's why we're going to keep modeling the different scenarios that could happen and continue to emphasize to Canadians how important it is that they abide by the rules and recommendations and guidelines set forward by Health Canada, by Public Health Agency of Canada.
We recognize how important it is for people to have information on how this fight against COVID-19 will continue. We will continue sharing information when we have it, as soon as we have it. But even though we have models that predict a range of scenarios, those scenarios are based on how people behave today. We will continue studying a range of scenarios and keeping Canadians abreast of what is happening.
Today, new screening measures are coming in place for airlines and trains. I'm wondering, many of these people who are conducting these tests to screen passengers for symptoms of COVID-19 are not medical professionals. So how are they expected to adequately do their jobs, and what type of training and protective equipment will these people have?
The fundamental principle we've put forward is if you have symptoms of COVID-19, if you feel you might have symptoms of COVID-19, stay home, self-isolate, don't go outside, don't travel. That is what we're asking of all Canadians. And these measures we've brought in for airlines and railways is an additional measure, an additional encouragement and expectation that people who have symptoms of a cold or of COVID-19 will not travel. That is extremely important, and it's something that, like so many of these measures we put in place, is going to rely on people stepping up, doing what is right, and not traveling if they have symptoms of COVID-19.
Last week, the business loan of, from the Bank of Canada, many pubs and bars and cannabis industry businesses are wondering why they don't qualify for that extended credit for businesses.
What we're putting forward right now is a wage subsidy that will help restaurants and bars and a range of businesses that have seen significant declines in their revenues because of COVID-19 and who've in many cases had to or are about to have to lay off their workers. Now they will be able to keep them on the payroll at 75% or more if they can top it up. of their salaries so that when we are through this, they will be able to pick up again where we left off and get our economy roaring back. That is our focus right now. In terms of access to credit, there are many mechanisms out there for businesses of all different sizes to access credit. For small businesses, there's a $40,000 loan, of which $10,000 will not have to be repaid if they meet certain conditions. There are many things we're doing out there with low interest or no interest loans to help businesses get through this. But the wage subsidy and the Canada Emergency Response Benefit for people who lose their jobs are going to be there to make sure that we come through this strongly.
Bonjour, Monsieur le Premier ministre, Christian Noël de Radio-Canada.
Prime Minister, Christian Noël, Radio-Canada. I'd like to come back to the armed forces. In some countries, they're being used to set up field hospitals, in others to deliver medical equipment. You suggested a few scenarios. Why might we need the Army, and in what circumstances, in what medical circumstances might they be useful? The Minister of Defence will have a press conference right after me, and he can talk to you about that at greater length. But what I will say is that the Canadian Armed Forces have always been there when communities have needed help, be it for flooding or other emergencies. So we have theoretical scenarios where their help might be needed. And as we know, the armed forces are able to do so many things. We will rely on them if we need them. And we will certainly always work with the provinces to see if they request help from the armed forces. We'll be there if needed. Regarding sanctions, you said that those who try to game the system will face severe sanctions. How will you determine who is gaming the system? And how will you sanction them? There will be a verification system in the coming weeks to make sure that the subsidies and the assistance to businesses is in fact going to the businesses and is in fact going to companies who need it. If businesses or individuals take advantage of the system, there will be serious consequences. This is a time when Canadians have to be able to trust one another, have to be able to count on one another, and those who take advantage of a crisis to turn a profit are going to face severe sanctions from society and from the government. We'll have more to say about that tomorrow.
From Maclean's. It's nearly April 1st, and thousands of Canada's smallest businesses are wondering how they're going to pay rent. Their workers are now covered largely by measures you've already announced, but the business owners themselves simply just can't take on more debt, even interest-free loans. Is rent relief on the table for them?
We know that the significant part of business expenses are around payroll, and our focus is right now on supporting workers, supporting Canadians so they can stay home, so they can make sure we're doing the things we need to get through this as quickly and as well as we possibly can. Our focus right now is on this wage subsidy of 75% for employers who need it. That'll give Canadian workers up to $847 a week, depending on what their salary is. These are measures that will make a huge difference in relief for businesses, in relief for workers, in ensuring our capacity to bounce back, to rush back strongly when this is all through. That is our focus right now. But as I've said, these are measures we're doing now. We are always going to look at, are there more things we need to do? Are there other ways that we can and must help people get through this difficult time? We will continue to listen and work with people to make sure that we're able to come through this as strongly as possible and get out the other side as strongly as possible.
Merci beaucoup. C'est qu'est-ce qui met fin à la conférence de presse d'aujourd'hui.
Merci tout le monde. Bonne journée.
And that's it for today. Thank you.
And that wraps up Prime Minister Trudeau's address to the nation. Obviously a lot there. Some news came out of today's address. Let's go to Abigail Beeman in Ottawa. And Abigail, we're learning a little bit more about this wage subsidy program to help Canadian businesses avoid layoffs. Let's recap what we learned and a little more clarity, at least, because that's what a lot of business owners certainly have been demanding ever since this was announced last week, and then the evolution from 10% to 75% of the wages. What more do we take on that?
Well, some big news here from what the Prime Minister is saying. Remember, when this was initially announced, it was for small and medium-sized businesses. So the big question was, how many employees do you need to have to qualify for this? Today, the Prime Minister says all businesses, it doesn't matter what size business you have. It just matters that your revenues have decreased by 30% due to the coronavirus. So all businesses would qualify regardless of employees just meeting that revenue standard, and charities as well.
All right, we will have to leave it there. The Finance Minister will be speaking more on this, and we hope to get a little more details. For all of us here at Global News, we want to thank you so much for watching and making us part of your day. Global National will have full details. Thank you again for watching.
This is a really critical week in our fight against the coronavirus. I really can't emphasize too much, as Minister Hajdu has been doing, as the Prime Minister has been doing, as Dr. Tam has been doing, that Canadians must practice physical distancing. I know that it is hard, but we all must stay strong and stay at home unless we are doing essential work like stocking the shelves in our grocery stores, like working on the front lines of our healthcare system. Of course, you can go for a walk or a run, but maintain your distance while you do it and wash your hands, please, when you get home. Il s'agit d'une semaine critique dans notre lutte contre le virus. Les Canadiens et Canadiennes doivent pratiquer la distanciation physique. Nous devons rester forts et rester à la maison, à moins que vous faisiez un travail essentiel comme remplir les étagères à l'épicerie ou fournir des soins de santé. Vous pouvez aller prendre une marche ou courir, mais restez loin des autres et lavez-vous les mains lorsque vous rentrez chez vous. Je sais que c'est difficile, mais nous pouvons le faire. So today we will hear from Canada's Chief Public Health Officer, Dr. Tam, the Minister of National Defence, Harj Sajjan, et le leader du gouvernement à la Chambre et le lieutenant politique pour le Québec, Pablo Rodriguez. Also available to answer your questions are our Minister of Health, Patty Hajdu, the Chief of Defence Staff, General Jonathan Vance, and the Deputy Chief Public Health Officer, Dr. Howard New. We are trying to spread ourselves out, which is why you don't see them here at the podium, but they are available for your questions. Dr. Tam.
Hello, everyone. So in Canada, there are 6,671 cases, including 66 deaths. In addition, at any point in time, there are many other people under investigation for COVID-19. They're awaiting lab results or not yet tested. So even if you're not hearing of cases in your community, it doesn't mean that there are no cases or that there are no exposures waiting to happen. We now have completed tests for over 220,000 people in Canada, with about 3% of the people confirmed as positive and over 93% confirmed as negative. So of the over 6,000 cases that we know about right now, approximately 7% are requiring hospitalization and 3% are critically ill, with 1% having been fatal. This is data for what's happening in real time, so we can expect these rates to fluctuate as and when the provinces report new information publicly. Des cas ont été signalés dans les collectivités à risque élevé de complications graves de la COVID-19. Notamment, ce week-end, un premier cas de COVID-19 a été déclaré au Nunavik, dans le nord du Québec. Des éclosions dévastatrices continuent aussi de survenir dans les établissements de soins de longue durée. Des mesures préventives sont essentielles pour empêcher l'accélération de la propagation dans les milieux clos où vivent des personnes atteintes de problèmes de santé sous-jacents. La prévention est un élément clé de notre intervention face à la pandémie. There have been reports of cases in communities that are at high risk of severe outcomes of COVID-19. Notably, the first case of COVID-19 was reported in Nunavik in northern Quebec this past weekend. In addition, there continue to be outbreaks in long-term care facilities, leading to devastating outcomes. It is crucial to prevent the acceleration of spread in enclosed environments where persons with underlying medical conditions reside, and it is a key part of our pandemic response. With the warm weather approaching, I want to reiterate my message from yesterday. Our key focus right now is on preventing spread in returning travelers and protecting at-risk individuals and communities. For this reason, I am stressing for travelers returning home from outside of Canada, snowbirds, March break vacationers, and others, you are required to take the right action to protect all Canadians. Head directly home, do not stop for groceries or other essential supplies. Pick up the phone, get online and order what you need, but do not go out into public spaces. Once home, you're required to remain there and quarantine yourself for 14 days. Likewise, some important religious observances are coming up, including Easter, Passover, Vaisakhi, and Ramadan. Now is a time when all assembly needs to happen virtually. Prepare ahead to connect through social media and over the phone and internet. Thank you.
Okay, thank you very much, Dr. Tam. Now we will hear from our Minister of Defence. Harj, please.
Thank you, Christia. Good afternoon, everyone. When Canada needs our armed forces, they are always there. They show that in times of great difficulty, Canadians never face hardship alone. They fought for Canadian values during the Great Wars. They've been there for our friends, our partners in the Pacific, in Ukraine, and across the Middle East. They have been there for Canadians when impacted by storms, like earlier this year in Newfoundland, or floods, like last year in New Brunswick, Quebec, and Ontario, or forest fires, like those that hit Alberta and BC in previous years. And we developed our defense policy, Strong, Secure, and Engaged, in order to support our armed forces to be prepared and equipped to deal with the challenges that lay ahead. And now, during these unprecedented times, those who wear the uniform will be there for Canadians when called upon. And that is why we took precautionary measures early to ensure that the forces remained ready. And it is why, early in this crisis, the Chief of Defence Staff directed many of them to engage in physical distancing, to stay home, and be healthy and ready to respond. From the beginning, the Canadian Armed Forces have been a part of the whole-of-government effort in our fight against COVID-19, where the women and men in uniform assisted in bringing Canadians home from China and Japan to CFB Trenton. And over the past weeks, I've been in contact with my international partners and colleagues to learn from their experiences. With that information and looking at the possible needs across Canada, I directed the Chief of Defence Staff to develop a plan that would allow us to support a domestic response to COVID-19 based around 3 priorities. To support the efforts to slow the spread of COVID-19, to provide support to vulnerable communities across Canada, to assist our provincial and territorial partners with logistics, including directly supporting municipalities if needed. And I also want to stress that this response to COVID-19 would occur while still maintaining our ability to respond to possible floodings or forest fires. And based on this guidance, the Chief of Defence Staff has developed a plan that will see the Canadian Armed Forces mobilizing up to 24,000 regular and reserve force members across the Canadian Armed Forces to support these efforts. The Canadian Army have readied up to 10 regular force units across Canada. These immediate reaction units are ready to support any request for assistance. They can play a critical role in providing humanitarian support and delivering supplies. They'll be ready to respond to support Canadians no matter where they live. Also made available, reservists and Canadian Rangers are being brought into full-time service and will be part of an integrated Canadian Armed Forces response. These flexible teams are capable of operating as local response forces to assist with humanitarian support, wellness checks, natural disaster response, and other tasks as required. I also want to emphasize that particular attention was given to Indigenous and Northern and Arctic communities. And these needs directed our planning. And that is why over 50 Canadian Ranger patrols will be available to enhance our understanding of the needs of the Northern, remote, and Indigenous communities, and we will be ready to respond as required. And our Royal Canadian Air Force has all necessary capabilities and personnel to support the whole of government response to COVID-19 while continuing to deliver on their standing commitments. The Royal Canadian Navy are also ready to respond on short notice to coastal communities who might need a helping hand. We are moving forward with this plan to help support Canadians no matter where they live, when, and where it is needed. Though we have not yet received any formal request for assistance, the team at the Department of National Defence and I continue to work with Minister Blair and Public Safety Canada so that we are ready when called upon. And we will provide local commanders the authority to be flexible in our assistance to ensure that local needs are met quickly. As I've said before, the Canadian Armed Forces remain ready to help Canadians during these challenging circumstances, while at the same time ensuring that the Canadian Armed Forces will be there to support communities that may be impacted by spring flooding and forest fires. The decision that we made early has made sure that the Canadian Armed Forces is healthy and stand ready to serve. And we will continue to make strong precautions so that take strong precautions so that the women and men who serve will stay healthy and ready to help. The planning we have done will allow our forces to respond to COVID-19 at home and to protect communities impacted by potential natural disasters, while allowing us to continue the important work we do with our allies and partners to support international security. We will be there. We are ready to help. And no matter how challenging the circumstances, when called upon, the Canadian Armed Forces are ready to serve. And to all our Canadian Armed Forces members and their families, thank you for your service. Thank you.
OK, thank you, Harj. Et maintenant, je donne la parole au leader du gouvernement à la Chambre, Pablo Rodriguez. Pablo, s'il vous plaît.
Merci beaucoup, Christian. Alors, essentiellement, notre message d'aujourd'hui, c'est qu'on est prêt. On a demandé aux forces armées de développer un plan de mobilisation pour que, si ça devient nécessaire, on puisse les déployer là où on en a besoin, que ça puisse se faire rapidement. On parle ici jusqu'à 24 000 membres des forces armées, que ce soit les forces régulières, la réserve, l'aviation royale, la Marine royale du Canada. Et notre plan d'intervention, s'il est requis, se baserait sur 3 priorités. Tout d'abord, soutenir les efforts visant à ralentir la propagation de COVID-19, fournir une aide aux communautés vulnérables dans tout le pays, aider nos partenaires provinciaux et territoriaux en matière de logistique, notamment en soutenant directement les municipalités. Concrètement, par exemple, on pourrait se servir de nos hélicoptères et de nos navires pour appuyer les communautés isolées, certaines communautés autochtones. On pourrait appuyer les provinces, les municipalités directement dans leurs efforts. On pourrait aider avec la logistique, le transport de matériel, l'aide humanitaire, bref, partout où les provinces et territoires auraient besoin d'aide. Évidemment, on le sait, le travail peut être lié à d'autres choses. Je pense notamment au niveau des inondations, des feux de forêt. Donc, nos troupes peuvent fournir toute cette aide nécessaire à ce niveau-là, tout en ayant et en maintenant la capacité d'appuyer les efforts de lutte au coronavirus. Mais soyons clairs, le ministre l'a dit, on ne planifie pas de déployer nos forces pour l'instant. On est en contact quotidien avec les provinces, avec les territoires, et pour l'instant, aucun premier ministre nous a demandé un déploiement. Alors, pour nous, c'est fondamental de continuer à dialoguer, de discuter et de collaborer avec le province. Essentiellement, donc, ce que l'on dit aujourd'hui, c'est qu'on sera prêt à intervenir si un premier ministre nous le demande officiellement. La planification que les forces armées ont faite va leur permettre de se déployer rapidement pour aider les Canadiens qui en ont besoin. Et on sera là pour tous les Canadiens, peu importe où ils se trouvent. On ne laissera personne derrière.
OK. Merci, Pablo. On est prêt à répondre à vos questions.
Thank you, Deputy Prime Minister. We'll start with 3 questions on the phone, 1 question, 1 follow-up. Ensuite, on va prendre les questions dans la salle. Operator.
Thank you. Merci. If you have a question, please press star 1 on the telephone keypad. Si vous avez une question, appuyez sur étoile 1 maintenant. The first question is from Lina Dib de la presse canadienne. Please go ahead. Votre ligne est ouverte.
Oui, bonjour. Ma première question est pour vous, Madame Freeland. Je sais que des détails viendront demain avec le ministre Morneau, mais pouvez-vous simplement m'indiquer pourquoi le gouvernement a changé d'avis et décidé que cette subvention au salaire ne serait pas limitée aux PME, pourquoi à toutes les entreprises?
On n'a pas changé d'avis, on a précisé les détails. Et choix qu'on a fait, les détails qu'on a choisis sont absolument corrects, je dirais même nécessaires pour l'économie canadienne. Nous comprenons que le coronavirus et l'impact économique du coronavirus ne distinguent pas entre les grandes, les petites et les moyennes entreprises. L'idée de ce programme, c'est d'aider toutes les entreprises canadiennes à préserver les emplois. Nous savons que les entreprises veulent maintenir ces travailleurs et nous savons aussi que pour un Canadien ou Canadien qui a un travail maintenant, c'est beaucoup mieux de toujours avoir son travail. Et pour cette raison, on a créé ce grand programme pour aider les employeurs à préserver l'entreprise et surtout à préserver les postes pour les travailleurs. Ce programme est une très, très bonne addition à le programme qu'on a annoncé en avance, le programme pour aider les Canadiens qui n'ont pas un travail, qui ont perdu son travail ou qui ne peuvent pas travailler à cause du coronavirus. Avec ces 2 programmes, on a un programme pour aider les gens qui ne peuvent pas travailler, un autre programme pour aider les entreprises à maintenir les postes des travailleurs très important dans cette situation. Et on a aussi aidé les entreprises, aidé l'économie en créant beaucoup de ressources financières. Merci, Lina.
Ma seconde question est peut-être pour M. Rodriguez ou sinon peut-être M. Hadjan pourrait répondre, je pourrais retraduire. À propos des forces armées et votre capacité de les déployer, il y a une communauté en Abitibi, une communauté autochtone, Long Point, ce matin, a envoyé une lettre réclamant l'armée de l'aide pour pouvoir assurer son état d'urgence. Elle veut fermer son territoire. Est-ce que vous répondriez à cette demande à elle, aux demandes des communautés semblables, ou il faut que ça passe par le premier ministre de la province?
Harj, why don't you go ahead and then maybe Pablo will...
No, in fact,
do you want me to translate?
We have translation. No, I wanted to say, one, we are in touch with many remote communities, especially Indigenous communities, and the Chief of Defense Staff has been planning kind of early measures of what we can do. But more importantly, there's also steps that can be taken early on, not just with the Canadian Armed Forces, but also with the provinces and territories. So we're taking every request very seriously, and I just want to remind that the Canadian Armed Forces is part of a whole of government response. So when we look at a concern that comes up, we look at the whole toolbox in our government, and including right down to the municipalities, so that we can make sure that the right response is there, so that the Canadians impacted by anything that they're going to be looked after.
Merci. Thank you. Next question.
Thank you. The next question is from Bill Curry from the Globe and Mail. Please go ahead. Your line is now open. Votre ligne est ouverte.
Thank you. My question is for Ms. Freeland. In terms of large companies and future announcements coming up for the aviation and energy sectors, other big companies, is the government considering direct ownership stakes in private companies, as we saw with the auto sector in 2009? Will there be any conditions with that in terms of executive compensation? And is the government concerned about foreign takeovers of Canadian companies during this period?
Thank you for the question, Bill. I think, as you probably expect, I am not today going to preempt future announcements. I will say to you, and I'd like to assure all Canadians, that we very much understand that particular sectors of the economy, whether it is tourism and aviation or the energy sector, are facing particular strains because of the impact of the coronavirus, both in Canada and worldwide. We are very mindful of that, and it is something that we are definitely focused on.
One follow-up.
Yes, on another topic, since the Service Canada offices shut down, there's been a lot of stories about people not able to reach an official on the phone to answer their questions. They can't get help in person as they're trying to get EI and other programs. So is the government trying to reopen these offices? How are you dealing with this problem?
Of course, it's very important for Canadians to have access to the government programs that we've put in place over the past couple of weeks, and we are working hard to be sure that Canadians can have access to those programs, even as we are thoughtful about and mindful of the need to be maintaining physical distancing in our daily lives and the need to ensure that people who work for the Government of Canada are also safe as they do their work. I know that it is hard for all of us, whether it is in the delivery of government programs or whether it is, as Dr. Tam was describing, for returning snowbirds not to be able to go to the grocery store and to have to figure out how to order their groceries online or over the phone. It is not easy to operate in an economy and in a society where we all have to practice physical distancing, but it's what we have to do. And I do want to say to all the Canadians who need access to these programs, we get it. That's why we have put these programs in place. I really apologize sincerely for some of the kinks in the delivery of these programs, but I want to assure people we are working 24/7 to get that support out to Canadians.
Merci, Madame la Vice-Première ministre. Opératrice, prochaine question, s'il vous plaît.
Next question. Thank you. Merci. The next question is from Bruce Campion-Smith from Toronto Star. Please go ahead. The line is now open. What's running into it?
Hi, good afternoon. A question perhaps for General Vance or Minister Sajjan. I'm just wondering if you can speak just more specifically about the type of help that the military might be able to provide. In the U.S., we're seeing, the military there provide field hospitals, military engineers to help kind of re-engineer civilian spaces to makeshift hospitals. So I'm just wondering, sort of practically, what could we see if the call from help from provinces came?
Turn on your mic.
I was speaking with Secretary Esper on a number of the last few days on what they've been doing, but it's also to keep in mind every situation is going to be very different here. And what we're doing is making sure that we have a force that's able to respond to the various needs. We are the last resort when it comes to providing support. So the composition that we have created and the priorities that we have set out is to making sure that we're flexible, be able to respond directly to whether it's a surge of a need, whether it's a northern community that needs direct support, whether it's a logistical support. So there's a wide range of support that allows the Canadian Armed Forces to respond. So we'll give the Chief will kind of go into a few details of it, but just keep in mind that we are able to respond across the country from across the coast and with particular attention to the North and the Arctic. Chief?
Thanks, Minister. If I could start off, I'd just like to say and offer condolences to people suffering right now on behalf of the armed forces. I know it's a tough time for the country. We've been preparing for a long time for this. We've got good plans in place, and we've got the troops sequestered, staying as healthy as possible so we can mount several thousand people at the same time if we need to. The fact is that, Bruce, it's a great question. We are going to be able to respond either with specialist capabilities like medical, logistics, engineering for a short duration event or for longer duration events, depending on what the need of the provinces is. We're also looking at significant responses in the event that communities start to suffer multiple events, including floods, forest fires, inside a COVID environment, where the armed forces will be able to put in place necessary support to critical infrastructure, logistics, as well as some medical support. So it's scalable, Bruce, depending on the nature of the problem. Thank you.
Bruce, one follow-up? Okay, we'll turn to the room for 3 questions before we go back on the phone. Mackenzie, CTV.
Questions for you, and Ms. Haidu, if you would want to comment on this as well, I'd like to hear your thoughts. Dr. Tam, a few days ago you said that a well person does not need to wear a mask, but when you take a look at countries that have done quite well in dealing with COVID-19, South Korea, Japan, Taiwan, generally the culture in those countries has been to wear a mask, and public health has told people to wear masks. So is Canada not telling the public to wear masks because we're worried about a shortage and we want to make sure that doctors and other frontline people have them?
I think there's 2 separate reasons. I think for sure, absolutely, we want to protect our frontline healthcare workers, and prioritizing supply in that setting is critically important, and we're looking at all sorts of different avenues to procure. For the public, I think the current scientific evidence we are continuing to evaluate. Of course, we can be flexible if we find any new evidence. But I think the scientific evidence is that if you are sick, then put on a mask to prevent those droplets from flying, in any space as you're perhaps going to a clinic or having to move yourself around the community for essential needs. Putting a mask on an asymptomatic person is not beneficial, obviously, if you're not infected. If you're a close contact of a case, and under certain circumstances, especially, you'll also be in self-isolation, by the way, if you're a close contact of a case, and you also need to move for any essential reason. That's perhaps another situation. What we worry about is actually the potential negative aspects of wearing masks, where people are not protecting their eyes or other aspects of where the virus could enter your body, and that gives you a false sense of confidence. But also, it increases the touching of your face. If you think about it, if you got a mask around your face, sometimes you can't help it because you're just touching parts of your face. The other thing is the outside of the mask could be contaminated as well. So the key is hand washing, absolutely, for sure. It doesn't matter what you're doing, hand washing is really key. When you're removing a mask, in numerous infectious diseases, even in the hospital setting, we find that it's removing personal protective equipment that can actually lead to infections. So if people try to use these measures, they have to be really, really careful and wash their hands. Absolutely, that's the key. So we're also worried about the negative, potentially negative impacts.
Prime Minister said that as COVID-19 goes on, we can expect to get more accurate testing. So you've said right now that about, I think 93 was the number today, of people who've been tested have been deemed to be negative. They don't have coronavirus. Are you concerned about the accuracy of the testing as it currently stands? And can you tell us, when you get tested, what is the accuracy level? Is there a number there that we can know?
So the tests available at the present time are what we call real-time PCR. And they have been validated. The labs that can actually confirm a case have been validated by the National Microbiology Lab or by their provincial labs, which were previously quality assured by the National Microbiology Lab. So these tests are highly performing. But of course, when you're taking a swab of someone, and sending it to the lab, etc. There's multiple components. One is that you got to test the right person at the right time. So if you test someone too early, you may actually not get a positive sample. You may have to retest. How the methodology, how well you swab that sample might come into play as well. So there's clinical judgment in whether maybe someone needs to be retested if they were negative in the first place. So it depends on the circumstances. But the actual PCR test is very specific and it's quite sensitive.
Thank you, Dr. CBC.
Thank you. Dr. Tam, to follow up on the testing, how confident are you in the numbers, especially in Ontario? We're hearing about rationing of tests, long, waits to get results. We're hearing, that ICU numbers may be underreported. And also, does it concern you that Ontario is testing people at a much lower rate per 1,000 people than other provinces?
So I think the collective public health goal is to increase testing, for sure. So we are doing everything that we can right now to increase the capacity of testing in Canada. For sure, though, if you actually looked at the numbers of people tested per capita, Canada is one of the highest per capita testing countries in the world. But we can do better. And I think that we need to be able to support jurisdictions into getting through any sort of rate limiting steps. So we are looking at everything in terms of upping the capacities of provincial labs, but also these new diagnostics, which have been mentioned, I think, by the Minister Haidu and others. So we actually are currently at the NML, at the National Microbiology Lab, looking at some of these new testing methods and more near-patient testing methods to see if they can be validated. And if they're accurate and they perform well, we are going to be, providing those. But I know that authorities in Ontario are trying very hard, for sure, to provide those tests. But what I do know is that hospitalized patients are prioritized for sure. You're going to be testing people in ICUs, hospitalized patients, healthcare workers, long-term care facilities, all of those very much higher risk situations. Provinces know that they are prioritizing all of those populations.
Merci, Dr. Tam. Follow up.
And my follow-up for Minister Sajjan. Just to clarify as well, how do Northern and First Nation communities ask for assistance? And also, is the Armed Forces prepared to help neighborhoods, such as one we're seeing in Quebec right now, with quarantines?
We're able to provide direct support into northern communities, and we have a very good process in place. And so over the previous years, we've been responding to floods and fires and evacuations for certain communities. But the Canadian Armed Forces there to respond to any type of emergencies, and we have contingencies in place. We also have a very good process as well as we maintain our communications with the territories and various communities. We also have Canadian Armed Forces leadership in those communities as well, especially through our Canadian Rangers. And through the territories, we're able to have the ongoing dialogue with the with public safety and the Canadian Armed Forces. And this is not done in a sequence. This is all done all at once. So we have a very good understanding very early on what the needs are so that we can actually get ready to respond with the right resources. If the Canadian Armed Forces are needed, we're prepared to respond. And when it comes to quarantine, we have to be mindful that, again, the Canadian Armed Forces is just, again, part of the wider government resource. So when it comes to quarantine, we have to take a look at is based on the right expert health advice and the right officials, the decisions will be made what's actually required. Yes, we can provide support, but we want to make sure that we're providing the right support. So across the country, it could vary on various things that we can provide, whether it's quarantine, logistical support, medical support, but that's going to be based on each unique need that's there, and we're going to make sure that our commanders on the ground have that flexibility to be able to respond quickly as well.
Merci, Monsieur le Ministre. Une dernière question dans la salle avant de retourner au téléphone. Mike.
Nice question in the room.
You, Minister Sajjan or General Vance, I'm just wondering, how do we know we have enough troops to handle this situation? It's something we've never done before. How confident are you that we can respond at this time?
One is, when it comes to historically, the Canadian Armed Forces have always been there at time of need. I can assure you that this is an unprecedented time. We haven't been in this type of crisis before. but the Canadian Armed Forces, with the whole of government approach, will be able to respond to this. Because one, the front-end healthcare workers to first responders from police, fire, and paramedics, the Canadian Armed Forces have always worked together on various other challenges. So this is no different. We'll put the right support. We have the resources, and we have the right leadership to be able to plan for the long term.
International commitments, because the world still goes on. How are we still able to continue with our international commitments while all this other stuff is happening?
No, it's a very good question. Keep in mind, the rest of the world is also dealing with the COVID-19 environment. And I've been in touch with my counterparts across the world, and I have a number of phone calls today as well. We're learning from one another. We're looking at the current missions that we have, whether it's the work that we do at NATO, in Ukraine, in the Middle East. We're making minor adjustments because of the COVID-19 environment. For example, capacity building that we used to do, well, it's not happening because in certain areas we can't, like Ukraine, we can't do capacity building for this reason. So we're making sure that the force is protected as well. And we're also very mindful that that we're looking at any adversaries that might try to take advantage of the situation. So we're very mindful of that, and we're taking the right measures. And this is what, when you've already been operating in a very close multilateral environment, something the Prime Minister has emphasized greatly, and through those relationships, we're able to deal with these various threats.
Okay, we'll turn to the phone for 3 last questions. Operator.
Thank you. Merci. La prochaine question est de Marie Vestel de Le Devoir. Votre ligne est ouverte. Please go ahead.
Oui, bonjour. Ma question est pour vous, Madame Freeland. Je voulais revenir sur le point de presse de vendredi dernier. Vous avez parlé de cette possibilité-là que les États-Unis déportent des réfugiés qu'on leur aurait renvoyés à la frontière depuis que la frontière est fermée, même aux migrants. Donc, je voulais savoir si vous avez une mise à jour à nous offrir sur l'état de ces discussions-là. Vous disiez que vous étiez en train de urgently discussing, je pense que c'était vos mots. Donc, avez-vous une mise à jour sur l'état de ces discussions-là? Est-ce que vous avez obtenu des garanties de la part du gouvernement américain sur ce sujet? Et êtes-vous au courant de cas de réfugiés qui ont été renvoyés aux États-Unis par le Canada depuis le 20 mars et qui ont été déportés dans leur pays d'origine?
Merci pour la question. Comme nous avons dit, comme j'ai dit vendredi, c'est vraiment un enjeu qui concerne le Canada. Moi et le ministre Blair et notre ambassade à Washington, nous avons tous eu des conversations concernant cet enjeu et les conversations continuent.
OK, donc j'en comprends que c'est pas réglé. Est-ce que vous êtes au courant, cela dit, de cas qui aient réellement eu lieu, de gens qu'on a renvoyés aux États-Unis et qui ont été déportés, ou est-ce que c'est juste une crainte théorique?
C'est une des questions qu'on a posées maintenant.
Merci. Prochaine question, s'il vous plaît.
Next question.
Thank you. The next question is from Jorge Barrera from CBC. Please go ahead. Votre ligne est ouverte.
Thank you. Minister Freeland, there's been some First Nations leaders, particularly the Southern Chiefs Organization, Manitoba, who would like to see human doctors come in to help deal with the potential outbreaks in their communities. I'm just wondering how your government feels about this request.
Our government has every confidence in the excellence of the Canadian medical system, in the excellence of Canadian healthcare workers. People have been hearing over the past few days a lot from Mark Miller, the minister charged with Indigenous services, and he has really been emphasizing the extent to which the government is aware of the particular vulnerabilities Indigenous communities face. So I have huge faith and trust in Canadian frontline medical workers. They are doing a great job, and they're going to continue to do that. I wonder if Dr. Tam wants to say anything more about our medical workers.
So I certainly work very closely with the Chief Medical Officer of Indigenous Services Canada, and absolutely, if there's any request and need, there are mechanisms in place. We also have mechanisms for mutual aid between different jurisdictions, and should that be required, that can also be channeled through the Public Health Agency of Canada.
Thank you, Doctor. Follow-up?
Yeah, so what I'm hearing is that through the mutual aid, it is possible to bring in Cuban doctors to help if particular First Nations want that help, because, there's reports about doctors being pulled out to deal with other regions. I'm just wondering if this is something that is a possibility on the table right now.
Let me just say and be very clear that we are very confident that Canada's healthcare system, which is staffed by outstanding healthcare professionals, has the capacity to deal with this extraordinary challenge. Our job as a government is to work very hard to provide our healthcare system with all the resources it needs to take care of Canadians, Indigenous and non-Indigenous, and we are very aware of the particular challenges vulnerable communities face.
Thank you, Minister. Next question on the phone.
Thank you. The next question is from Émilie Bergeron, Agence QMI. Votre ligne est ouverte. Please go ahead.
Bergeron from Agence QMI.
Oui, bonjour. J'aimerais savoir au sujet de la possibilité de recourir à la loi sur les mesures d'urgence. Ça fait plusieurs semaines que ce scénario est étudié. Où on en est dans cette réflexion, cette possibilité-là?
Alors, comme le Premier ministre l'a dit l'autre jour, il n'y a absolument rien qui est exclu, mais à ce moment-ci, c'est vraiment pas sur la table. Il y a des discussions en cours tous les jours avec les différentes provinces et on est confiant que les provinces, à travers les outils qu'elles ont, les différentes municipalités, font leur travail. Je dois noter le très bon travail, notamment réalisé au Québec. Et donc, c'est un outil qui fait partie de cette boîte d'outils-là, mais qui n'est pas envisagé pour l'instant.
Merci. Au sujet du plan pour une possible intervention de l'armée, est-ce qu'il y a déjà un ordre de priorité qui est établi? Par exemple, intervenir dans une province en premier par rapport à une autre?
No, there is no priority set. This will be based on the needs on the ground. The assessments that will happen across the country. And we have a very good system in place based on our previous experience to be able to triage the right request and making sure the right support is provided. But having said this, we've also had make sure that the plan that that General Vance has put together for the Canadian Armed Forces allows us to be very flexible, to be respond to multiple areas if needed, being able to respond to communities while at the same time to be able to respond to floods and fires if need be, and at the same time to be able to respond to northern communities and isolated communities if required. So there is no priority per se. This will be based on the expert advice from our officials.
Merci. Ceci met fin à la conférence de presse. That's it for today. Thank you.
Thank you. The conference has now ended. Please disconnect your lines at this time, and we thank you for your participation. La conférence est maintenant terminée. Veuillez s'il vous plaît raccrocher votre ligne. Et merci de votre participation.